chair down there.
Okay.
Come back to this so we can.
Now Dr. Marc is
We
going
can
to
show
ink
the
up the
doctor.
pad.
It's very simple. We just put a few dots of ink onto one side of the pad. It's indicated here. And we just roll out that ink until it's very nicely spread and thoroughly covering the pad. It's very easy to do. There's a bunch of paper, one-sided. On the other side, you flip the pad over so that when the patient steps on this side of the reverse side of the pad, it puts an imprint on from the ink side onto the paper that's underneath the pad. So we're going to demonstrate that now on the what do you call it?
Harrison Mac
No.
impression.
In time.
In time.
Sorry about that.
So now we would tell the patient to sit down, take his shoes and socks off. So I'm going to act as the patient and have them roll their cuffs up because we're going to take a movie afterwards. And I'm a normal pronator, and for over 20 years, a doctor that treated me in New Jersey and wrote 4 books on bad backs never looked at my pronation, never looked at my foot. Kept adjusting my back, making me better after 2 or 3 visits until the next time it would go out. Until I got bilateral heel pain, which is a true story, and had 3 surgeries on my right heel and the right orthotics to correct it. Okay, you tell me what to do.
Okay, so we're going to have the patient now stand a few steps away from the pad. And we're going to have them walk in that nice neutral way, stepping on the pad along the gating. Once that's done, we'll just flip it over, take a quick look at the foot, and have them come back and do the other side.
Now the doc, for those professionals that are watching this, he's just going to tell you a little bit about what he sees on those papers.
So upon looking at the impressions, the heavy ink shows where the extra pressure is as the patient's walking on the mat. When you see a large amount of coverage where the arch should be, it's very logical, the arch is falling. So this patient is pronating much heavier on the right foot than the left foot, and you can see the imprint along here where the foot is dropped down. The extra pressure on the first, second, and third metatarsals on the right foot, the second and third on the left foot, indicate that's where he's putting extra pressure down. A little extra pressure on the right heel, that tells me his body weight is not balanced.
And if the doctor orders cutouts, depressions, metatarsal pads, all kinds of things to take the pressure off. Here's some examples I hope you can see. And maybe you can zoom in. Here's a cutout if somebody had a dark impression on the little 5th metatarsal area. Here's a depression here for this 3rd metatarsal.
This is where the customizing of this orthotic and lens lab works best, because we use the combination of the gait analysis, which we'll even do more of in a minute, the pedograph right here, and the cutouts for the metatarsals to take the pressure off of the toes once the orthotic has been made.
Also, we could add a metatarsal pad to lift up, which is another arch. It goes across the 1st to the 5th to relieve pressure. And usually you would keep a copy in your office and put this and send this to me in the box if you're a new doctor. Then I would discuss it on the phone, or Dr. Marc would, and go over how to order the orthotic to take off the pressure points and what to order for you. Including, if we make our famous dress orthotic for sandals, soccer shoes, running spikes, ladies sandals and men's sandals, all the above can be built in. Metatarsal pads, cutouts into the famous number 1, 2, 3 dress orthotic for women's sandals and shoes, and sports shoes.
That show the array of, on the board up here, you can see all the different types of orthotics that we can make. Some are heavy duty, some are cork, some are for diabetics, some are for dress shoes, and there's different models, different sizes here, just to demonstrate the variety of orthotics that are available in the lab. All custom made from the casting that you take in your office. All right,
Okay, cut.
correct, okay.
And we're gonna move slowly.
We have our patient sitting down. Now we're going to demonstrate a gait analysis. How the feet are supposed to be moving while we're doing the gait analysis, and then the interpretation of it. The camera's on the floor. I'm being videotaped by our cameraman. The camera that we are going to use in your offices are on the floor. It's a fantastic system, and we'll demonstrate that right now. So I'm going to have the patient stand up right over here. And Len will also demonstrate some of the things that we're doing. So in a normal standing gait right now, he could be seen with considerable pronation. If he rotates his foot out and up a little bit, there's the supination we want to correct and put his foot into neutral. Now we'll demonstrate with the other foot. And back down. Bring it down. There's the pronation. That is his norm. So if you stand natural for a minute, face the camera. Right here, you can see the full pronation of his foot. And if he was to rotate his foot up a little bit, that's neutral. This is where the casting should be taking place once we do the casting. So now we're going to do the gait analysis. Stand where you are.
Show the patient what he looks like.
You can demonstrate to the doctors also.
And this is where the patient's gonna learn exactly what neutral is.
And what they're doing that's causing a lot of their pain, what their foot is actually doing. The patient will actually get to see this once you show it to them on film. So here's what we're doing now. I'm coming behind the front desk here and just clicking the camera on.
Notice it's only one simple click.
One click. I'm going to turn this to our cameraman just to show him and you. This is what we look like here.
As you can see me, I'm only about 14 feet away, so most doctors have a hallway, a room, and it's so simple you could train any of your staff to do this. And Mark has a movie of every patient, so he has a record of what they were like when they walked in the door before he treats them.
Okay, once again, the camera is located on the floor about 14 feet away from the patient's feet. They're going to walk about 12 feet up to the camera and stop.
Okay.
So now Len's walking along.
At a nice slow pace, and he'll tell me
Stop right there.
and even up both feet.
At this point, you can see quite clearly on the screen. Do you want to get that into the picture? Here's the patient's feet in his normal position. Now Len, like I demonstrated earlier, turn your foot up, the right foot first. There's that position we want to keep him in, subtalar neutral. Put it down. That's the pronation that the patient's actually living with. Turn it up again. That's normal for us. That's what we want to create in our offices so that the patient has support underneath that right foot when we put an orthotic in his shoe.
And usually tell the patient you're going to count 1, 2, 3 so they know to hold it in that position. They give you a couple seconds to get a good shot of it and then tell them to drop it down.
And drop it down. Now the left foot, same thing. Lift it up.
1, 2, 3.
Drop it down. There's the pronation again. Lift it up one more time. Drop it down. And
Now,
relax. Turn around for a minute.
Okay, before we turn around, this is just for the physicians. We normally have the patient turn around, but I'm going to turn around in a 45-degree angle so the cameraman can actually zoom right in. And let me know when you're close. And at this point, I'm going to bring up the right angle to subtalar neutral, which is approximately there. My heel look vertical in the middle of the leg. Well, I can't see the back from there, Mark. Only the cameraman's looking at me right now.
That's fine.
So, and now I'm going to drop it down. Then I'll bring this one up for the cameraman. Drop it down. And then at this point, you would have the patient turn around in the office, and you handle this part.
Once again, walk to the starting point.
I'll tell you what, let's show everybody how we bring the right ankle up now. 1, 2, 3, and drop it. Let's bring this one up. 1, 2, 3, and drop it. Now the patient is actually seeing their pronation. But I'm going to face the camera right now for the physicians so you can see it better. I'm going to lift the right foot up to about neutral. 1, 2, 3, and I'm dropping it. And as I bring this one up, Dr. Marc's going to go on the ground and try to show you the deformity I have of about 9 degrees of forefoot varus, which is why all the training is here. So when you send the cast in and you watch the other movies, you'll see how important it is to cast correctly. And that's how I can tell how the deformity in the patient's foot. So I'm going to bring this foot up and hold it here.
And right under here where you can place, right under here where you can place a bunch of business cards, that's where the deformity is. That should be held up higher in a neutral position throughout the whole foot, the ankle, the talus, the navicular, and the cuboid, and that's what we're going to try and stabilize.
Which is all built into our semi-flexible plastic orthotics, as you see when I molded the X18 on the film, and my famous dress orthotic has the same type of angles built into it, but yet it'll fit in sandals, ladies' dress shoes, men's tight loafers, running spikes, which is a new thing now, and soccer shoes. Now I'll turn around, and Dr. Marc would ask this patient, and he's going to ask me right now,
Okay.
to walk back. And at this point, he will tell the patient to walk back to the camera, but about halfway. And again, ask me to take the right foot and hold it up. Count 1, 2, 3. Drop it. Lift it up. The left one. 1, 2, 3. And then he would stop the camera. So please stop the film. Now at this point, when we play it back to the patient, you would take the mouse.
We should show them that.
It's going to be hard for you to see it, but you would place the mouse on the right knee while you're showing this to the patient. And as you lift up, as I'm lifting the foot up to neutral, they'll see the knee rotate. And this is what you're going to get. Oh wow, no wonder my knee hurts. I didn't realize my knee rotates in and out. No wonder my hip hurts. No wonder my back hurts. If you're a PT, the people don't know why you were even sent there to get therapy. They don't understand that their ankle, their pronation, is making the knee hurt. And that's one of the things you're treating for. Could be treating for the hip, tendonitis, fasciitis, all the problems in the bad back. So this movie is not just to help you sell orthotics. It helps to sell all your services in the office. And when Marc started to see the patients realizing what it is, I'll let him give you a couple words on that, they automatically wanted to have the services. Before, they had no clue what the chiropractor would do for them. Is that correct, Marc?
Exactly, and from a chiropractic perspective, as we were shown, way back in school, structure starts from the ground up. So when we are putting in a custom-made orthotic into every patient's shoe, sneaker, workout boot, workout shoe, exercise shoe, slipper, ski boot, the foundation is supported all the way through whatever we're doing. And as long as we do the right chiropractic adjustments, we're going to have a patient that's going to respond better and be able to improve quantitatively. High heels as well. Sandals as well.